A few years ago, FDA inspectors went to a drug manufacturing lab in India owned by Sun Pharma, and they found that conditions there were really bad. So they said these drugs cannot be imported to the US right now. Shortly after that, through a little known program, the FDA said, well, some of them can come in because we don't want drug shortages. I'm Emma, a senior health reporter at MedShadow.org, and this is Healthy Curiosity, what we're reading. This week, we're reading this article from ProPublica. So, for the last 2.5 years, Sun Pharma was allowed to import about 12 drugs made at this lab into the United States. In June of 2025, the FDA went back to that lab for the first time. And as you can see here in the ProPublica article, those problems that they initially noted had yet to be fixed. The inspectors found that employees weren't following protocols to prevent items like bacteria or other microbes from getting into the medications. They weren't maintaining equipment that's required to quality control the medications, make sure they have the right dose. Initially, the list of medications that they were allowed to import into the US was over 12. Now that seems to be down to 5. If you want to make sure you know which drugs those are, take a screenshot right here. And if that's not frustrating enough, this is a screenshot from the FDA inspection report that was released to ProPublica under a FOIA request. As you can see, they've blacked out this whole section up here. That's the list of drugs they think might be affected by these problems. At MedShadow, we're also working on a series of articles about the compromised quality of drug manufacturing here and overseas. So if you want to keep up to date on that, follow along here, then go to medshadow.org, check out our articles, and sign up for our newsletter and maybe even our webinar series that's upcoming.